Welcome to the BDI Empowers podcast, where experts simplify disability benefits so you don't waste years figuring them out. Now, get empowered.
Good morning, everyone. Thank you for the opportunity to present again to this wonderful, wonderful group. I'm always appreciative when I have an opportunity to speak to families. And so before I start, I want to speak a little bit about my story. I am a mom. I am a nurse by profession, but I think one of the things I love the most is the fact that I'm a mom of a special child, special children, let me say that. So in 2003, I became a mother to twin girls. You know, one of those really amazing journeys, you're so happy that this has happened. But then one of the twins was medically fragile from the very beginning. She was on a ventilator and she needed tube feeding from the day one when she came out. You expect to hear that your baby came out and they're breathing and they're talking and crying at least. She wasn't making a sound. So we spent months in the hospital. And when we were finally discharged, we were just so happy to go home and begin our new normal. That wasn't so. That night, when we got home, I found out that she had contracted RSV. I just saw the way she was breathing. And I said, oh my God, this isn't good. And so we had to separate the babies and rush back to the hospital where we stayed for another month. So between the complications during my pregnancy and having these babies, the first 1 to 2 years of their lives, I don't think we slept. It felt like we lived in the hospital. We lived in doctors' offices. Medications was the order of the day. And many of you can relate to my story. And that is what led me to start Kind Touch Healthcare Services in 2015, because I wanted to support other families who were going through a similar situation. And I wanted to make sure that they didn't feel alone, because I tell you, there was a day I remember just sitting in my closet and crying. And my then 2-year-old, because she turned 2 the day the twins were born, you can imagine, she came over and put her arms around me in my closet. And she said, I love you, mommy, I love you. And that just made me cry even more, if you can imagine. So we came through that. And today I still support families during those early years. I'm still there, but I'm also there to help with transition, as a lot of our children are transitioning into adulthood, because they still need the support. The need doesn't go away. It just changes the way that it looks now as they get older. So today we're going to walk through this whole thing. We're going to look at what this transition looks like into adulthood. We'll start by discussing what changes after pediatric care, and then we'll go into some of the common challenges, and we'll talk about some challenges that caregivers face. And from there, we'll look at how home and community-based support like mine and others can help in everyday life, including some of the services, some of the waiver options that you may not be privy to that may help you and your child. We'll also talk about supporting independence. And that is things like daily living skills, community involvement, and even for some of them, preparing for work. I know it's something we are like really for some of our children. And finally, we'll go over when it might be time to consider additional support and what that looks like when you get to that point. Let's start with what changes. So after pediatric care ends, one of the biggest things, the first thing you're going to notice, and I'm having a lot of families in our agency go through this, you will notice a big change in the system. You know, when they are younger, the system is more structured. And so you will see the pediatrician, it's a team, the doctors, the therapists, especially social workers, everybody kind of work together. And there is a guided help to help you with your care of your child. But as they transition into what we call adulthood, that coordination is not always there. So my own child, I'll give you a personal story. When she was in high school, she was just finishing high school at age 18. She came home one day frustrated. I don't know what happened. I don't remember. And she said, Mommy, who came up with the idea that when we turn 18, we're supposed to know everything? I was like, huh? Did she just say that? I said, what happened? She said, I'm so frustrated. I don't know anything. Oh, as a mother, my heart just broke. And I hugged her and I said, you know what? You are not expected to know everything. That's why mommy's here. That's why we're all here. Daddy's here. The family's here to support you. But it's frustrating for them, even for those who cannot verbally tell you how they feel, just like my daughter did. And for you as a caregiver, because a lot of those responsibilities that sometimes a pediatrician used to help now shifts onto you, the caregiver. You're now finding yourself having to manage the appointments, coordinating the services, filling in the gaps that did not exist before. You know, we have a grandmother right now who's caring for her grandchild, and she has been the primary caregiver since the beginning. And I went to visit them the other day. She's like, how do I find a dentist? And, you know, the pediatrician is not giving me the name and this and that. And so we're helping her through all of that process. You know, even when you're doing this, at the same time, there is a stronger expectation for independence from them. Individuals are expected to manage more of their daily lives. But for many, especially our children with developmental or behavioral needs, that transition isn't always smooth. You know, if you have other children who do not have any diagnosis, don't have any issues, you still understand how that can be. So imagine adding a medical need, you know, a developmental issue or behavioral need to that. And so one of the most important things that I want you to understand in this is that the needs don't go away. And I'm sure you know, they don't disappear. Certainly when your child turns 18 or 21, they simply change. And sometimes they become more complex. You know, it was easier when they were 1 or 2 or 3, you know, and that is why having the right support in place during this stage becomes so very important. Let's talk about what this actually looks like now that we've chatted about the changes. In a day-to-day for many families, one of the biggest challenges is just managing daily living activities. Simple things, really. Some things that other people take advantage of and just think it's not a big deal. Things like bathing, dressing, eating, simple routines. These are not just quick tasks for them. You can't just say, hey, John, run into the bathroom, take a bath, let's go, let's go. You can't do that. They can take time and structure, and you need to have patience above all every single day. So another major area that we're worried about as parents of these beautiful children is their safety and supervision. So many caregivers feel like they can't leave their loved one alone. I cannot tell you how many mothers, especially, I come across as like, I can't leave my child with anybody. I don't think I can do that. You know, because this is your life. This is what you've been doing for so many years. So many caregivers feel like they cannot leave their loved one alone, even for a short period of time. There is always that concern. Will they be safe? Is someone going to treat them badly? You know, then there are those behavioral and emotional needs. And this might look like anxiety, you know, resistance to routines or behaviors that can be difficult to manage without consistent support. And here's one real life example I want to share with you. I worked with a caregiver, a mom of an adult daughter who was struggling with transitioning, and she would become so overwhelmed when leaving the house. Even something as simple as them going to Kroger, you know, just going to the grocery store became very stressful for both of them. So they stopped going out altogether. And as a mom, you can imagine what that means. You can't just run and pick up salt at the grocery store while you were cooking and you remembered something. It became very difficult for them. And, you know, many individuals who want independence. The child that you're looking at who's becoming an adult wants independence. I've talked to so many of them, and that's it. I just want to be able to do it by myself. Some of them, they act it out because they cannot tell you. And so without the right support, families can feel stuck like this woman was until we got in. So instead of growing independence, things can become very limited. And finally, one of the biggest challenges is something we don't talk about enough, and that is caregiver burnout. As I mentioned earlier, I've met caregivers who have not had a break in years. I spoke to a family 2 weeks ago where the mom said, I have not gone out with my husband in 18 years. We've never had a date. I don't know what that is. I have not left her side for 18 years because they're constantly on managing everything. And over time, that level of responsibility will become exhausting. And that reality is, it is very painful for some people. Sometimes you don't even recognize it because you're going. But I want you to know that you are not supposed to do all of this alone. No one is supposed to do it alone. It's not a burden that is placed on you and say you must carry it all by yourself. So this is where home and community-based supports really matters. This is where we come in. This is where you need that help. It makes a big difference. I had nursing services because there were twins, and then I had a 2-year-old. So really it was like having triplets. I had to have nurses, and I was a nurse already for many years. I was a professor in nursing school, but I needed support. I needed help. In fact, we had so many people. I had my aunt who was a nurse, and then we had an outside agency coming to support us during those early years. And then the transition period became difficult because everybody sort of were gone because they were like, oh, she's got it. They're doing okay. And so in this moment, you still need the support, starting with daily routines. Having that consistent support in the home can help with things like hygiene, which is very, very important for them, meals and the structure. And that consistency is especially important for individuals with developmental or behavioral needs. It helps to reduce stress and it creates predictability. Another key area is behavioral support through routine and consistency. When you have the same people, the same structure, the same caregivers, the same supports in place regularly, you often see fewer challenges. They don't need someone coming and go out. They don't need different people. They don't need to be introduced to different situations. Consistency is what keeps stability over time. Then there is the respite care, which is incredibly important so that I tell mothers, just go get coffee. I'm a coffee person. So just a coffee break, go get coffee, go out, just relax for a minute and you come back refreshed. Let someone else be there with them. In fact, they behave differently. They behave differently when you are not there. We have a young lady right now that we would go take her to her appointment, and she's chit-chatting with the caregiver that's taking her because they're about the same age. So they themselves, inside of them, they want that break. You deserve that break too. It's incredibly important. It gives you the opportunity to rest, take care of yourself, simply step away for a period of time, knowing that your loved one is still being supported. We also have community-based supports which help individuals get out into the community, whether that is to go take them to the grocery shopping so that they can learn how to pick up their own grocery. What you see is not what the world sees. I need to pause for a moment and tell you that. You see your baby who struggled since they were born. You see as a young person who may not have the capability to do certain things. But the world sees an adult. The world sees this tall man or this woman. And so they don't understand. And what people don't understand is scary. And what people don't understand, they don't care for. And so we need to protect them, but we also need to prepare them for the world. And so this is where this kind of community involvement, community need, care, support is very important. Someone takes them to the grocery store and help them to learn how to pick up their own groceries, how to walk to the register and pay, going to their own appointments, participating in activities. I remember when I let my daughter go to her first doctor's appointment. I don't know. I was like sitting the whole time wondering how this appointment was going. And she did awesome. She did great. She came back and I was like, how did it go? So what happened? She's like, slow down, slow down. This is what happened. This is what happened. And so just me learning, it is never easy, never easy. But I had to let her drive her own care at some point, and some children may never get to that full ability, but you will have support to help them. So this is where independence really begins to grow. And over time, all of these supports work together to help the individual build life skills and confidence at their own pace. Everyone goes at their own pace, And I know I tell stories, but I bring real life into the situation so you can relate. Even in school, I remember when the twins, my daughters, a teacher compared them. That hurt my feelings so bad. And I had to go speak to the teacher and speak to the principal. And I say, you never, ever, ever compare them, because each person goes at their own pace. You don't know her challenges. She's gone through stuff that her twin sister have not gone through. So each of our children will be given that opportunity. We need to follow them and allow them to develop their own life skills, build their own confidence at their own pace. And one of the things I tell parents is, we're here to support you. Support is not about replacing you as a caregiver. Nobody can ever replace you in the life of your children. It's about partnering with you so that both you and your loved ones are supported in a sustainable way. Because after a while, some of these children become taller. They become taller than you, some of these children. They become bigger than you. You can't carry them. You cannot, reach over them. You need help, and you yourself need help, okay? So the support is there, but you also have to have a shift in your mindset and allow the help to come. All right. I want to take a few minutes to talk about something that families either they're not fully aware of or they're finding it confusing. That is the waiver services in the state of Georgia. There are certain programs that for some families, they've been caring for their children forever. Income might be a situation. They don't know, they don't have all the money that they need, or, some financial difficulty. So as you transition, then maybe some of your children are receiving GAP, the Georgia Pediatric program, they're receiving services through GAP or any other source, or maybe DODD is helping. And as you transition them, you want to think about some of these waivers that will also allow you as a parent to have a little bit of financial compensation if you want it for the period that you want it, while still being able to give them care. And that's the CCSP and SOARS. There are others, but CCSP and SOARS have the structured family caregiving option. So through their programs, families may be able to access services such as personal care, help with daily activities, and respite, and community-based support. One of that is the structured family option that I spoke about that can help financially. And that's one of the things that we're doing with children. Our children that are transitioning is guiding the families, giving them the option to apply into these waivers for whichever one works for them, whichever one the child gets approved, especially the families that say, I still want to be able to receive some financial help while I am caring for my child. And so we kind of guide them and we transition them into that waiver, because we're doing all of the waivers in the state because we want to keep guiding and being there to support our families. The goal is really to support, to help your child stay in their home. I am so happy when I see there's a gentleman, I call him a gentleman, and when I go to talk to him, he's 19 years old. We sit and we have a conversation, like really, he is very, very articulate. He just got out of living with his grandmother and he lives alone. And he's got behavioral issues, but he's doing well. And we, sometimes there's a time that the caregiver goes and he'll call and he say, I didn't like how this person did this and this. And then we'll talk to him. And then he called last week and said, the caregiver that came, I really like her. Can she stay? And we're like, sure. And I think she likes you too, so she can stay. And so they're going to get a haircut, going to the barber shop, going out in the community. He's getting things done for himself. And he is independent, and grandmother can still check in. So I would say this, many families either don't realize that they qualify for some of those services, or they're not sure how these services actually work in real life. So even just being aware of these options is a really first important step for you. And then you can, ask questions and we can guide you through that. All right. So one of the most important goals for many families, including mine, is always helping your loved one to become as independent as possible. Why I say that is because as parents, we need to realize that we will not always be there. You won't always be there. That's just life. Life happens. Things may happen. How do you prepare them for that moment when you, mom, dad, grandmother, granddad, auntie, uncle, when you are not there anymore? So it is one of the biggest goals is to help them to become as independent as possible. And that starts with the care of themselves, daily living skills, being able to take a shower, take a bath, those hygiene needs, preparing simple meals, a sandwich, something, and being able to follow routines. This may seem small, to you or to people who are just like, that's not a big deal. But these are the foundation of independence. Independence doesn't happen overnight. It is something that is built step by step at a pace that is right for that particular child. With the right support and consistency, individuals can begin to do more for themselves over time. And as those skills develop, so does their confidence. They feel, they made a sandwich, amazing. They feel good. I've been to see some of these young people where they go, hey, Dr. B, I made a sandwich today. I was able to pour my juice and do things. I mean, you could just see the joy in their faces. You see, when someone feels capable, they are more willing to try new things and engage more with the world around them. But when they are having difficulty with even the simplest task, there is a frustration and there is that thing, anxiety, that they don't want to interact with the world, So this is where community involvement becomes so important. Whether it is for them to go to the grocery store, like we've talked about, attending their own doctor's appointment, participating in certain social activities, these experiences help to build real life skills. I've seen individuals who initially needed full support just to go out. And over time, with consistency, little by little, simple guidance, they were able to participate more independently, even taking on small responsibilities during those outings. And for some individuals, this can even lead to volunteering or work opportunities. There's another young gentleman that we used to see when he sees me I think he worked 2 days a week. When he comes back and I go, he wants to tell me about all the things that he did. Oh my God, I did this. I had to slow him down to, calm down, telling me how he was bagging the groceries at the store and how he met friends and how he did this, and this is all dependent on your child's abilities and the goals that have been set for them. It's always important to have goals. The key is having the right support, the right level of support in place so that independence is built safely, it is done gradually, and it is sustainable. You don't want to start something that you can't finish. We hear that all the time. So we want to start something that we can sustain. one of the things that people say is, so how do I know? How do I know when it's time to bring in additional support? How do I know? 2 days ago, I received an email from a mom. I'm telling you, it was like she wrote me an episode. I think she might have said, I don't know how long it took her to sit down and write all of that. Even I felt overwhelmed reading it. And then I felt sorry for her. And she's asking all these questions and she's trying to determine how she can get help. When can she get help? And after I took it all in, I sat down. I was like, I don't want no disturbance. I want to respond to her line by line because I understand she didn't want to talk over the phone. She needed something written so that she can follow through. So I had to include policies that summarize the policies of what she was asking for her to help her make decisions. So I want to tell you as a parent, there are a few signs that can help guide your decision on when should you get support. One of the biggest is the feeling of just overwhelm, physically or emotionally for you. When you are constantly managing everything on your own, it becomes very exhausting over time. Over time, you can't coordinate. You're not sure if you're going or you're coming. And you find yourself depressed and you find that you need to be on medication too. And it happens to the best of us until you realize, I spoke to a mom who my heart went out to her. I had to hold her and say, we need to pray about this because she said, I feel responsible for my child's life. I feel responsible for what happened. I'm like, in what way? You couldn't have possibly willed this upon your child. And when you feel that kind of way, it becomes very difficult for you to let someone else in. So one of the other things that will happen after you are feeling like this, there is a safety concern. Are you going to be able to do what you're doing for your child as safely as possible? If you start feeling that way, because then you yourself, you're not trusting other people, you're concerned about your child's safety with other people, you don't think that they can care for them. When you begin to feel like that, even leaving them for a short period of time with someone, if you feel afraid, that's important. You need to pay attention to that. You may also notice that daily routines are becoming harder for you to manage, or that things feel less consistent than before. Before you were just moving through it, it was seamless. And now it's not as seamless as it was. Sometimes there are changes in behavior. There is increased anxiety, there is resistance, or there are other challenges that are harder to manage. This coming from your child, and it's hard for you to be able to manage them without an additional support. And so in many cases, families feel like progress toward independence has slowed down or it's stopped. Because when they were 10, you were seeing, okay, maybe they started off with a feeding tube and they weren't talking, and with therapy and all of these things, tube is gone. They're doing a little bit better. They're taking steps or something good is happening. And then bam, there is a stage where transition comes in, things are happening, you're feeling overwhelmed, and you're like, what happened? They're not progressing anymore. Things are getting worse. That is a sign that you need help. And one of the most important signs, something we don't talk about often, is when you realize that you yourself have little to no time for yourself. At this point, who are you? We don't know who you are. Without calling little John, you don't exist, And I know, like in an African culture, women would be called after their children, like Destiny's mother, You don't have a name of your own. There is no Blessing. There is no Dr. B. There is no you. And it's like your whole identity is tied to your child. What about you? You have nothing going. Some people don't want to hear that, but your children need you to be wholesome. They need you to be okay. So when you realize that there is no time for mom, no time for dad, no time for you, you're always on. There is no opportunity for you to rest or recharge. I want to say this clearly, that needing support is not a failure. I hope that sinks in. In fact, recognizing when you need support is really one of the most important steps you can take for you and for your loved one, for you and for your lovely children. Needing support is a good thing. You don't have to do it alone. What is important is that you get the information and that it's a practical information that you can need. You can use. You can start preparing yourself if you're not there yet. You can start preparing what you're going to do when your family gets to this point. So you don't have to do this alone. You don't have to navigate it alone. So before I come to wrap this up, I want to say this. If you take anything at all, let it be this. You don't have to do it alone. Simple. It is not punishment. It is not a load. It is not a burden that has been placed on you, whereby if you just allow someone to come and then you failed yourself or your child or, anybody. Okay, many of the challenges that we talk about, like managing daily routines, ensuring safety, trying to build independence while also taking care of yourself. These are real. They can feel overwhelming, but support is there. I drove 2 hours to see a family, and the young lady, she's a young mom, had her baby very young, and she used to have the support of her family and her parents. And now she's by herself and the child is transitioning. And she's like, I didn't even know what was available. And I saw you on TikTok, and I was like, wow, yeah, I get on TikTok and talk about what's available so that families, because I realize I go to where the families are. People just want to go through. So the social media, so I'm going to tell them this is available for you. And she said, I didn't know that this was available. I didn't even know that I could use the help. And I'm looking at how long she has gone through life with this child. And she said, I don't go anywhere. I don't have friends. And it's just the two of them in a 1-bedroom house. And I said, now you got people. Kind Touch is your people. We will not leave you alone. And we're going to hold your hands and we're going to walk through this together. But this is real for many people. And so managing daily routines, just ensuring safety, trying to build independence for them while also taking care of yourself can be a lot. But we are here. There are support, if not us, there are other people, and you want to make sure that you have the right support in place. And when you do, it just doesn't help your loved one. It helps you as well. So I want to say thank you again. I hope that the information I've given you is something that you can use, is something that you can relate to, and you can start the preparation for your child or maybe use it at this point.
This was BDI Empowers, your guide to independent living. Join us again next month to learn more about simplifying disability benefits.